Hello, my name is Sofia Olivares, and I am from UT Health School of Biomedical Informatics. In this presentation, I will be discussing our article titled Unpacking Misinfodemic During a Global Health Crisis, a qualitative inquiry of psychosocial characteristics in social media interactions. Misinfodemics, also known as misinformation crisis, have upended public health activities, as clearly evident during the COVID-19 pandemic. The impact of health misinformation can be detrimental, and it has incited anti-vaccination movements, false drug information, and even resulted in the deaths of many because of false cures or treatments. Therefore, misinformation presents many public health challenges, as it can diminish risk communication efforts and affect patient care. Currently, there are many computational methods that have been developed to detect and flag misinformation, such as deep learning models, which can recognize misinformation through statistical analysis of patterns. These methods, however, are not cognitively informed and do not factor in the dynamics of interpersonal and intrapersonal factors, which may affect opinion formation. Social media has become widely prevalent in our society, as over 50% of adults worldwide use these platforms. Social media has also become increasingly used for health-related purposes, especially among younger adults. However, social media makes it difficult to discern facts from opinions, which might facilitate the spread of false information. But given the high volume of content and the real-time interactions among users, it provides an opportunity to study the dynamics affecting critical decision-making and also develop cognitively informed interventions. The purpose of our study is to explore the manifestation of theoretically linked variables in health-related social media postings. This will be done by conducting an in-depth qualitative analysis of 4 variables of a social media posting, in our case a tweet, which consists of what is posted, how it's worded, who posted it, and how influential it is. By conducting this analysis, we strive to understand the dynamics between these variables with operational outcomes such as dissemination. These works provide a foundational understanding of factors leading to the COVID-19 misinformation crisis in order to learn the measures necessary to improve public health communication efforts. This figure captures our methodological framework, which was based on Carduni's misinformation framework, consisting of 3 key components, which are source, content, and consumer. Our framework models health misinformation dissemination by studying 4 variables in social media, which are content, structure, source, and dissemination. In the content component, we have included thematic compositions, information veracity, and theoretical underpinnings through the application of health behavior theory. In this study, we have also considered language structure by using embedded linguistic patterns and pragmatics to better understand persuasive features of human communication. We have also used a modified version of Searle's speech act theory in order to obtain a better understanding of the source's intent through the speech acts utilized. Source types have also been classified, and dissemination levels were also included by studying the tweets, retweets, number of retweets, favorites, number of followers, and friends. The example in this diagram captures how different people might perceive the same message differently based on their interests and beliefs. This highlights the importance of considering developing cognitively informed interventions that will take into consideration these factors. We retrieved our data from a publicly available COVID-19 tweet repository, which was created using keywords such as coronavirus, COVID-19, pandemic, and many others. We randomly rehydrated some data from that repository dating from January 2020 to January 2021. After removing the retweets and tweets not written in English, our final dataset consisted of more than 400,000 tweets. We then randomly selected a subset of 1,400 tweets, which were used for manual coding. We manually coded 1,400 tweets for veracity, theme, speech acts, health beliefs, and source types. We measure the interrelated reliability using Krippendorf's alpha for speech checks and Cohen's kappa for all the other variables. Statistical significance was tested using Pearson's chi-square test and Fisher's exact test. A veracity of the content was evaluated based on the COVID-19 guidelines from the WHO and the COVID-19 misinformation topics identified by different research centers. The health beliefs were coded based on the constructs from the health belief model, while the themes were derived from Chandrasekharan's study. Also, the speech checks were derived from a modified version of Searle's speech checks theory, and the source types were determined based on the user's profile description. Some of the categories we identified were public officers, governmental agencies, health agencies, and private individuals. We also assessed the content for linguistic structures, and this analysis was conducted using LUIX analysis software. The non-parametric Kruskal-Wallis test was used to determine statistical differences among different groups. Finally, dissemination levels were calculated based on interactions, which were a sum of the number of retweets, likes, followers, and friends. The thresholds for the different dissemination levels, which were high, medium, and low, were based on the interquartile ranges due to the skewed nature of the data. The figures show the distribution of the COVID-19 themes among true and false information, and also the different levels of dissemination. The interrelated reliability was 0.89, and there was a statistical significant relationship between themes and veracity. The post-hoc analysis showed that there was a significant association between the theme treatment and recovery, source and origin, and impact on the economy and markets, and veracity. The health belief results showed that the interrelated reliability was 0.81, and also that there was a significant association between HBM constructs among true and false information and the different dissemination levels. The post-hoc analysis revealed there was a significant association between veracity and the manifestation of perceived benefits, which were more prevalent in misinformation, and also perceived severity, which were also predominant in misinformation. The statistical analysis also revealed that there was a significant association between dissemination levels and perceived barriers, benefits, severity, and susceptibility. The results for speech checks showed that the interrelated reliability was 0.84, and there was a significant association between speech checks expressed and dissemination levels. The post-hoc analysis showed that declaratives and question were significantly associated with dissemination levels, declaratives achieving a higher percentage of high dissemination levels. This table shows the LUIX analysis categories that were significantly different between true and false information. Overall, true information was expressed using significantly more words associated with authenticity, analytical thinking, achievement, tone, longer words, and drives. In contrast, misinformation was communicated using more words associated with anger, function words, verbs, and pronouns. This shows that true information was communicated using more words associated with honesty, success, and positivity. The results for the source types showed that there was no significant difference between source types among dissemination of true and false information. However, they were statistically different among different dissemination levels. All the tweets created by official source types, such as research organizations, health agencies, public officers, and governmental agencies, achieved high levels of dissemination. The characterization of tweet content has revealed multiple differences in true and false information that could facilitate the misinformation detection. For instance, when it comes to structure, declarative speech checks were more predominant in true information, whereas assertion was more predominant in false information. This shows that true information was communicated more objectively, whereas misinformation used speech acts that relied more on personal beliefs. Additionally, the use of authentic and analytical words was more predominant in true information and significantly different from those of misinformation. Misinformation was also discussed predominantly in regards to themes related to the COVID-19 source or origin, also racisms and treatments. These themes, when communicated in misinformation, were often tied to misinformation strategies such as conspiracies, polarization, and discreditation of health agencies or officials. There was also differences on how speech acts were manifested in true and false information, as shown in the tweet example, which manifests perceived severity, but it downplays the severity of the COVID-19 pandemic. These results could ultimately be used to develop digital interventions that could address intrapersonal attributes such as cultural and health beliefs. These interventions will be cognitively informed based on the behavioral theories and extraction of persuasive communication features. Our study had some limitations. For instance, since our data was manually coded, our data set was limited in size. So a proposed solution is to develop semi-automated computational methods such as deep learning models in order to be able to evaluate a bigger data set. Another weakness was that we only analyzed data from one social media platform. So this study could be expanded to different social media platforms as well. Another limitation is that a validation is needed in order to ensure that there is a contextual relevance of the behavioral theories and Loic variables on health misinformation dynamics. In conclusion, our qualitative study helped us characterize the 4 principal variables of social media postings, which are content, structure, source, and dissemination, as well as their dynamics. This in turn helped us detect the theoretical, topical, and psychological attributes manifested in COVID-19 information in social media. This will help us design better public health risk communication strategies and tools based on human misinformation interactions. This study helped us obtain a better insight of human misinformation interactions, which are crucial to develop better educational tools as well as public health campaigns. By developing these tools that are cognitively informed, we will ensure that health consumers are resistant to harmful misinformation in social media, and they will also help build more resilient communities that are not as vulnerable to misinformation seeding and spread. Thank you for your time.